Hello, I'm Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. B2H serves children in foster care or Division of Juvenile Justice and Opportunities for Youth Community Services Supervision who've been diagnosed with serious emotional disturbance, developmental disabilities, and/or medical fragility. Once enrolled in B2H services, a child may continue to receive services even after discharge from foster care through age 21, as long as they are otherwise eligible. In this video, we'll be exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. This is Chapter 4, What are the Services and How were they implemented? Part 4, Special Needs Community Advocacy and Support. The purpose of this chapter is to help you better understand the B2H program services offered so that you can better inform parents and caregivers and help them understand the benefits of the B2H program. You'll also be able to help parents and caregivers recognize how their support is important in the provision of necessary services. Here to help us understand more about B2H and how it works is Isha Hines. Ms. Hines is currently employed at a healthcare integration agency. She has more than 10 years' experience in the child welfare field, working in group homes and as a foster care case planner. Isha, thanks for joining us. Special needs community advocacy and support improves the child's ability to gain from the educational and community experience and enables the child's school and the community to respond appropriately to the child's disability and/or healthcare issues. Isha, tell us about this service and what function it serves.
Sure. Special Needs Community Advocacy and Support permits the child to have a strong, informed advocate to interact with various organizations and schools in the child's community. So if we look at the services in regards to school, what it would provide is if a child is having multiple disruptions in school due to their healthcare needs or mental health diagnoses, the waiver service participant or provider will come in and provide education to the teachers, social workers, and other professionals that work with the child and basically advocate on behalf of the child to reduce these disruptions or calls home to the caregiver. In addition, if we look at this service as far as community, an example of that would be a young man who was part of a baseball team, a little league team actually, but he suffered from Asperger's syndrome, and one of his triggers was being touch. So what the waiver service provider was able to do in this situation was come out, meet with the coaches and the players to find out different ways they can show like the child made a good play or approval by. So what they did instead was come up with verbal prompts that they would give the child or say, good job versus giving high fives or pats on the back.
Because obviously those touches would negatively affect that child because of the condition that he has. Well, Isha, thanks very much for joining us. And that brings us to the end of Chapter 4, What are the Services and How are they implemented? Part 4, Special Needs Community Advocacy and Support. In Part 5 of Chapter 4, What are the Services and How are they implemented? We'll take a look at pre-vocational services, supported employment, and day habilitation.